How you doing? Is your girl Nurse Doris? How you doing? How is your family? Good morning, good afternoon, good evening, depending on your location and where you're watching me from. Today we're having another bonge topic. Please, if you have not subscribed to my YouTube channel at Nurse Doris, please try and subscribe, okay? And to my returning subscribers, thank you so much. Please share my poll, my video, like and subscribe, okay? Today we're having another ubonge topic. This is specifically for my pregnant ladies and my fellow women who are aspiring to be pregnant. Please just listen very carefully. Bring your Coke and Fanta and join and follow up, please. If you want to comment, if you want to add up to my teaching, or a comment or ask questions or bring up topics you want us to talk about, please, the comment floor is really open for you. Okay, today we are talking about pregnancy in diabetes in pregnancy. Okay, so in this diabetes, they call it gestational diabetes. Gestational diabetes occurs when your body cannot make enough insulin during your pregnancy. Okay, the main thing here is insulin. Okay, and the insulin is being produced by the pancreas. Pancreas is one of the organs we have in the body. Okay, so it's when your body cannot make enough into insulin to circulate to your cells. Okay, then here insulin is a hormone made by your pancreas that acts like a key to let blood sugar into the cells in your body for use as energy. Okay, here now the insulin now is just like a fuel that should circulate, penetrate into your cells, okay, to make your body have as in like to serve that will serve as a form of energy to your body. So here now, if your blood sugar level is above 190 milligram per deciliter, is if it's above that, that means you're having diabetes in pregnancy. And this diabetes in pregnancy is mostly identified in the 50th month of pregnancy. That's 20 weeks of gestation. You hear your doctor write for you, prescribe or give you a prescription paper. Go and check your blood sugar level. There they will give you maybe a sugar, a cup of sugar with water to drink to check your blood sugar after 1 hour. After 1 hour, that's maybe 2 hours. The first check is after one, then the next one after 1 hour too. So if it's high, that means like for above 200, from 180 200, as in too high like that, is you're having blood sugar, you're having diabetes in pregnancy. Or if like they have two types of check. That's the fasting blood sugar check, which is your sugar level, yeah, and that one is being checked in the morning before breakfast. That one you should be expecting like from 70 to 120. Then you have random blood sugar, the one you check when you finish eating, from 80 to 140. Okay, so your blood sugar should not pass 140. Okay, that's the random blood sugar. You should monitor, you should know what you eat even during pregnancy and when you're not pregnant. It's very important for the health. Here now, there are hormones, estrogen, cortisol, the hormones that can, there are during pregnancy there's a hormonal rise. Everything is in action. The estrogen, the cortisol, the human placental lactogen can have a blocking effect on insulin. This is called contra insulin effect. Okay, this is during pregnancy states. Okay, here now you've talked about the fasting blood sugar and the random blood sugar, the range. So before you eat in the morning, you have to go and check your blood sugar. If you can be able to buy the blood sugar check at home, your glucometer, you can buy it and check it yourself. It's very important, because women that have high blood sugar level, that are classified as high risk pregnancies. Okay, and it's not really good. It's not good in pregnancy. So there are things that can cause this blood sugar rise in pregnancy. Being overweight or obese or before pregnancy. So before pregnancy, if you are planning to be pregnant, 3 months before you're planning to be pregnant, you're meant to make sure you're having a good weight. Okay, a good weight, at least 75, at most 75 or 75 kg. Okay, so that before, as the pregnancy is aggravating, growing, you'll be weighing around that kind 80, highest 85. It's okay. Then after pregnancy, you can try to drop back to your normal weight, okay? Then if you have a family history, your family history of that you have a family history of diabetes, your family, you are having a, is from the, it runs in the family, okay? You can have this, it can cause it. Then if you have gestational diabetes in your previous pregnancy, maybe the first pregnancy, second pregnancies, you have gestational diabetes, you have risk of having it. If you're not being physically active, you don't go about, you don't walk around, you don't do exercise, you can have it, okay? The insulin will not be able to circulate into the cells for the body to use it in form of energy, okay? Then having previously delivered a baby weighing more than 9 pounds, so it can cause it. These are the causes. Then there are warning signs, that shows that a pregnant woman, this see ma, you're having diabetes in pregnancy. Number one is sugar in urine. That's why you need to go for a regular antenatal checkup. Then here they will check for your sugar, they will check for other things like sugar, BP and all these things. They check those things, glucose, they will check your glucose in urine. If it's, they have measurements, that what's the name of that, this thing, the check in the this thing they use in checking it, their I've forgotten the this thing they check it with. So you go, you try and be going for, be active, be regular in your antenatal checkup. Then if you're having frequent urine, especially at night, more than 6 times in a day, you keep urinating, you keep having excess unusual tests. If every time you want to drink water, my sister, just consider it having diabetes in pregnancy. If you're having blood vision, you're not seeing well, you consider vaginal, bladder or skin infections. It can be a sign that you're having the diabetes in pregnancy. If you're having numb or tingling hands and feet, you're having diabetes. Then dry skin, if you're always having dry skin, okay, just consider it, they're having diabetes in pregnancy. Then who are at risk of having diabetes in pregnancy? If you're over 40 years, okay? If you're over 40 years, that's late gravida, over 40 years of age. Okay, over 40 years of age. Yeah, if you are, as in getting pregnant over 40 years of age, you're at risk of having it. Those people that are at risk of having, that's people who are prone to have it. Then if your body mass index is from 30 and above, that's overweight, obese, it's not good. So try to be of good weight, okay? Have good weight. Then let's talk about foods that you need to eat to manage or to avoid this condition. You need to have eggs, salad with don't put all these preservatives they sell in the supermarket. You can just put olive oil, add little salt, put your salad, it's very sweet, it's okay like that. Then fruits like cucumber, you avoid sweetened fruits like banana. If you're having diabetes in pregnant, don't eat banana, okay? You avoid those fruits, those like banana, those kiwi them. They are fruits that are very sweet, you avoid them, okay? Apple, you can eat apples, you can eat whole grain bread. Avoid white bread because it has more sugar. Semi skimmed milk, you choose the milk you take, skimmed milk, okay? It is in the supermarket. You skip sugary foods, sugary drinks. Make your own fruit juice at home. Buy cucumber, buy your apple, you can make them at home by yourself. All this one, some of these drinks they sell in the supermarket is very sugary. Okay, if you're pregnant, just try to avoid them. Choose healthy fats, limit red meat and avoid processed meat, okay? Non-starchy vegetables like peppers, mushrooms, asparagus, broccoli, spinach, they are good, they are very good, they are very good and low in sugar. They are non-starchy, okay? They don't have starch. Lean meats like fish, chicken, turkey, eggs, just try inculcate those things into your diet. You see that there will be one, your sugar level will be on a moderate level, and you'll be losing weight. At least your weight will be not be adding more weight like that, because the more they hide the sugar, the more the weight, so it can lead to some complications. There are prevention. Avoid sugary foods. Check your blood sugar level. You can get this blood sugar check machine. Regular antenatal visits, okay, for early identification and diagnosis, okay? Eating healthy diet, avoiding sugary foods and drinks, mild exercise. You can work out, it can help, it helps. 30 to 1 hour workout in the morning, the evening, especially if you are pregnant, okay? Then There are types of diabetes in pregnancy. You have type 1 diabetes mellitus, diabetes insipidus type 2, which is the one that this type 2 is a gestational diabetes. Somebody being in gestational stage is the person is pregnant, or gravid stage is the person is pregnant. Okay, so there are complications if you're having this thing. If it's not controlled, if you don't go to hospital, you eat anyhow, you think you are eating a healthy diet, you don't know you're eating, you are at risk. And these people that have high diabetes, what they call it, pregnancy, they are high risk pregnancy people. They are high risk. Okay, here now, the complication can still birth. The baby can die in utero before the expected date of delivery. Birth defects. If the sugar level, within 3 months you need to go and check if the baby has any birth defects, because the baby have already formed that time. So you need to check if your sugar level is high before you even get pregnant, and keeps being high like that, it can make the baby to have a birth defect. Okay, so you need to be very careful. Renal problems can cause kidney problem, because you keep peeing out creatinine, you keep peeing out uric acid, you keep peeing out sometimes protein. So it's not good. It can cause renal problems, preterm birth, okay, and low birth weight. So treatment, your doctor can prescribe insulin for you. Yeah, there is the insulin you take during the day insulin, and the one you take at night. Okay, so we have come to the end of this video. We have come to the end of. Thank you so much. Thank you so much. Please, if you have other topics you want us to talk about, you can bring it up. We can talk about. We can share together. We can share knowledge. Everybody will learn. Okay, so you know how to manage your situation in case, or if you have anybody who is passing through the same condition, you know what to tell the person, the health talks to tell the person, and how to manage it. Please try to subscribe to my YouTube channel if you have not subscribed. Thank you so much. Bye bye.